All right, let's get right into it. If you remember one single thing from your PEDS rotation, make it this. A child is not, and I mean not, just a tiny adult. Everything is different. Their bodies, their minds, how they handle stress, so our care has to be different too. Today, we're going to walk through exactly what that looks like at the bedside for every single age and stage.
I want you to really think about this for a second. We've all been there, right? You walk into a room with a blood pressure cuff, the toddler sees it, and instant meltdown. Now your reading is totally off, the kid's upset, the parents are stressed out. It's a mess. This isn't just about getting the task done. It's about understanding the world from their point of view. And that leads us to our guiding principle.
This right here is the key to everything we're going to talk about, atraumatic care. It's a really important concept from our source material, and it basically means our job is to actively prevent trauma. We use specific strategies to make things less painful, less scary, and less stressful for both the kid and their family. This idea is the foundation for, well, everything.
So here's our game plan. We're going to start with newborns, who are completely dependent on us, and work our way all the way up to the complex world of teenagers. You'll see how each stage brings its own unique challenges, and of course requires a totally different playbook from us as nurses. Okay, first up, our littlest patients. For an infant, the hospital is this new, loud, overwhelming place. They can't tell you what's wrong, they can't understand a single word you're saying, and their only way to communicate is to cry. So, at this stage, our entire job really comes down to just one thing: building trust. And these two famous theories really tell us the whole story. Erickson says an infant is in a state of trust versus mistrust. Basically, they're asking, is this world a safe place? Will someone take care of me? At the same time, Piaget tells us that they're in the sensoromotor stage, meaning they learn only through what they can see, hear, and feel. So, when we're gentle, when we use a soft voice, when we comfort them quickly, we're literally teaching them that the answer is yes, this is a safe place. And since they can't talk to us, we have to become master detectives. We have to rely on what we can see. On the left, you see some of those basic reflexes, like rooting, which tell us how their brain is doing. And on the right, you see the cries scale. This is so important. We're not just guessing if they're in pain. We are systematically looking at their cry, their oxygen needs, their vitals, their facial expression, and how they're sleeping to get a real objective pain score. So trust is built through our actions. We do everything we can to keep parents right there at the bedside because they are that infant's home base. We swaddle them up nice and tight to make them feel secure. And here's a huge one. We always save the most invasive, most upsetting part of the exam, like checking ears or taking a temperature, for the absolute very end. All right, so now we move into the toddler years, and this is where things get interesting. This is the age of me do it, and their favorite word in the whole world is no. A hospital, by its very nature, is full of restrictions, which clashes directly with their brand new sense of freedom. That's the puzzle we have to solve.
Erickson calls this autonomy versus shame and doubt. They have this burning desire to do things for themselves. Piaget adds that their thinking is totally egocentric, which means they literally can't see a situation from anyone's perspective but their own. So when a toddler screams, "No!" when you try to give them medicine, they aren't trying to be difficult. They are practicing a critical life skill. Our job isn't to win a power struggle. It's to work with that drive for independence.
This year really shows you the paradox of being a toddler. On the left, you see them running, climbing. They are so physically capable. But on the inside, they still don't have the words to say, "I'm scared," or "that hurts." So how do they show us? With their behavior. Hitting, screaming, crying. And that's exactly why we have tools like the Flax scale on the right. It's like our translator. We look at their face, legs, activity, cry, and how consolable they are to figure out what's really going on. So let's go back to our blood pressure cuff problem. Here's the solution. You don't lead with the cuff. You get on the floor with them and play with the toy for a minute. You build some trust. Then, while they're sitting on their parent's lap, maybe you listen to their heart. Let them touch your stethoscope. Then you try the blood pressure cuff, but you make it a game. Okay, time for a big hug on your arm. And you guessed it, checking the ears and mouth is dead last. Now we're entering the magical, imaginative world of the preschooler. These kids are full of fantasy, but they also think in very literal, black and white terms. The hospital can be a really confusing place for them, and honestly, our best tool for connecting with them and helping them cope is through play.
So according to Erickson, they're in the initiative versus guilt stage. They love to be the ones to start a game or an activity, but, and this is a big but, their thinking is still very literal. This is so important to remember. They might actually believe they're sick because they did something bad. To them, a little poke from a needle isn't just a poke, it's a major attack on their body. This is why our explanations have to be super simple, super concrete, and very, very reassuring.
And this tool is just perfect for this age. Pain is a really abstract idea. How do you describe it? But a picture of a face, that's something they get. The FACES scale lets them just point to the face that shows how they feel inside. It gives them a voice and a little bit of control when they feel like they have none.
So, what does this look like in practice? We use medical play. We let them practice giving a shot to a teddy bear first. We give them simple, empowering choices. Do you want the dinosaur Band-Aid or the sparkly one? Which arm should we use for the blood pressure? Notice we're not asking if they'll do it, we're giving them a choice in how we do it. And we're constantly saying things like, "You are so brave. This medicine is helping your body get strong. You didn't do anything wrong."
Okay, now we're moving into the school-age years. We're leaving the land of make-believe and entering the world of logic and rules. These kids are like little scientists. They want to understand how things work, and that includes their own bodies and what's happening to them. They have a real need to know.
Erikson calls this stage industry versus inferiority. They want to be good at things, to accomplish tasks, to feel competent. And Piaget says they're in concrete operations, which means they get cause and effect. They can think logically. Put those two together and you get a kid who needs to understand the why. Why do I need this IV? What exactly does this medicine do? If we don't explain it, they can feel powerless, which undermines their sense of industry.
This chart is the perfect example. Physically, you can see their vital signs are starting to look more like an adult's, and cognitively, they're ready to understand what those numbers mean. You can actually show them the blood pressure monitor and say, "See, this is your number. We're trying to get it into this green zone here, and this pill is going to help us do that." You're making them a partner.
So our interventions are all about empowering them with information. We can use simple diagrams, explain things step by step. We can let them help. Maybe they can hold the tape for a dressing change, or help you record their fluid intake. We can also finally use the 0 to 10 number scale for pain, because they get what that means. And we have to start being really aware of their growing need for privacy. Always knocking, always closing the curtain. And last but not least, we arrive at adolescence. And this is a whole new ballgame. They're going through huge physical and emotional changes. Their world revolves around their friends, their body image, and their growing independence. Being in the hospital can feel like a direct threat to all of those things. Our goal shifts from being a caregiver to being an ally.
So what's going on in their head? Well, Erikson says they're in identity versus role confusion. They're constantly asking, who am I? Where do I fit in? And their friends are a huge part of that answer. Cognitively, Piaget tells us they can now think abstractly. They get complex ideas and long-term consequences. So our approach has to respect both their advanced thinking and their intense social needs.
This really means we have to change how we communicate. We talk to the teenager, not over them to their parents. We give them absolute privacy and might even ask the parents to step out for a few minutes. We're honest. We don't sugarcoat things. We work with them to make a plan of care, and we validate their concerns, whether it's about a scar, losing their hair, or just missing a big game. Building that alliance is everything.
It really all comes back to this one idea. This quote from the source material just says it all, doesn't it? From an infant who can only cry, to a teenager who might say nothing at all, how a child feels and shows pain, fear, or anxiety is completely tied to where they are developmentally. So our care has to be just as specific.
And that's really what I want to leave you with. It's one thing to know the theories, to know Erikson and Piaget, but the real goal is to let that knowledge change how you walk into a room, how you approach that toddler with the blood pressure cuff, how you explain what you're doing to that preschooler, how you build trust with that teenager. That's not just nursing, that's the art of pediatric nursing.